Welcome to this webinar on the blood pressure technique, which is taught on the practitioner course. The blood pressure technique is fantastic for inappropriate blood pressure. So whether it is high blood pressure or low blood pressure. We're not diagnosing someone's blood pressure because we might not even take it. If you've got a machine, then you're more than welcome to take it. But if you haven't, you don't need one, so don't worry. All we're testing for is the blood pressure appropriate for this person? Because we all run on a different level. The average and what the doctors like on paper is 120/80. Although 110/70 is probably the absolute ideal. High blood pressure will give you all kinds of nasty symptoms like dizziness, headaches, palpitations, low energy, breathlessness, and many more. And the low blood pressure will give you dizziness, heart palpitations again, faintness. You can really feel sudden drop in energy and a sudden feeling like you're actually going to faint, which isn't pleasant at all. So this test is to see whether the blood pressure is appropriate for your client, and if it isn't, then we can help with the magnets. Now, the other thing that we need to know about the heart and circulation of blood before we start is the fact that your heart, which is in the centre slightly to the left, is usually the size of your fist, roughly around that. Having said that, whether you're 4'10" or 6'10", the heart doesn't really vary in size that much. So how can that be? How's that blood getting around the body? Well, that's a very good question. Our heart is a continuous pump which beats all day, all night, looking after us, keeping us alive. However, with the heart rate, what can happen is that people can feel very unwell when it's out. Now, the other way the blood gets around the body is by the heart spinning the blood. Now, if your heart was a bigger size, then maybe you wouldn't need the spinning, but it isn't. So it was created to get around the whole body, because remember, some people are like way over 6 foot, and their heart really isn't that much bigger than someone much smaller. So the way it gets around is to spin the blood as it leaves the heart into the rest of the body. Now, what these magnets do will encourage the spin or lessen the spin, depending what's going on within the body, and also start to balance the blood pressure within the person, because the heart is highly electrical. So the magnets do a wonderful trick, and it's a very, very easy technique to do. So the circulation is quite amazing. Now, if you get cold hands and feet, then the circulation probably isn't getting around too well. And often that's to do with the thyroid, and often that is to do with the lower blood pressure. Whereas feeling very hot and sticky and a bit anxious with that is often to do with high blood pressure. So we've got Deneen here today, and we're going to see if Deneen's blood pressure is appropriate for Deneen. Okay, so off we go. So the first thing we need is to use the quad as a sim. So off we go. Check it in the clear, check it's working nicely, which it is, and check that it switches off. You may have a red and blue magnet like me, and if you do, then it's the blue side, the north side, that switches the muscle off. If you have an orange magnet, you use the side with the N on it. Okay, so we've got a nice sim there. Next thing we need to do are 2 pre-checks, because we're checking over the heart and we're also checking T1, over T1 here, the back. So we need to see if those areas are clear first. So I'm going to get Deneen to put her hand over her heart, and we're going to check that sim. And hold for me, please. And hold again. It's a little bit weak there. Okay, so what are the options here? The options are to rub between 2 and 3, a major distance away from the sternum, which is the heart lymphatics, so we can rub those. We can also hold the anterior fontanelle to clear this area. So this is the pre-check. So we're clearing this area. If this had been kept the sim strong, then we would have moved straight on, but it didn't. So I'm just holding the anterior deltoid here. Not anterior fontanelle. Apologies, it's just been a bit of a disturbance. Okay, so now we can also clear the area using a laser pen. Okay, so you can see here we've got a nice red light. If you can, it's good to go under the clothes to get it going right into the skin. So I'm going to use that to clear any congestion over there and give the lymphatics another rub. And they're better already, actually, aren't they? Yeah, good, lovely. Okay, let's just see if that's enough to have cleared it. The other thing you can do to clear is hold over the heart and hold over the forehead like that. Okay, lovely. So let's go again. And off we go. And hold for me, please. Right, and again, please. Right, lovely. So that's nice and strong. So that's our pre-check over the heart. Now we're doing our pre-check over T1 at the back of the neck. And hold for me, please. Ah, that's rock solid. And hold once more, Denise, please. And hold. Absolutely rock solid. So we don't need to do anything there. If that had turned the sim off, again, we would have laser pen over the area, rubbed all around the area of the neck, rubbed all around T1, and also we could hold around T1 and hold the SR points as well to clear it. Okay, so now all our pre-checks are done, and what we're going to do now is hold them together. So this is the blood pressure test. The blood pressure test is to hold the hand over the heart and at T1 at the same time to see if Denise's blood pressure is appropriate for Denise. Okay, you ready? Get that hand tucked right down a little bit further. That's it. Okay, lovely. So what we're going to do now is have a look at that. And hold for me, please. Okay, lovely. Right, so we've detected an imbalance here. Now, we don't diagnose, although I am going to ask Deneen some questions as to, how she's feeling. So, Deneen, what do you suspect with inappropriate blood pressure? Low. You suspect low? Yeah. What kind of symptoms do you get? I get dizziness. Dizziness? And I get numb fingers. Numb fingers, right, okay. And it gets cold, my fingers go white. Okay. Right. So we think it's low blood pressure, but it doesn't make any difference what we do with the magnets because we always test the magnets as to which the body would like to have the combination. So let's have a look. So I'm going to put my blue down. Right, okay, before we start, I meant to say this right at the beginning, you never ever do this technique on anyone with a pacemaker. It's dangerous, we cannot go near, we don't even put our magnets near anyone with a pacemaker. It's best just to take them out of the room if any of your clients have one. So no switching any muscles off with magnets with someone with a pacemaker. Okay, but Denise's definitely not got one, so we're okay. Right, so the magnets need to attract. So it doesn't matter where you start. I'm going to put blue down first. So I'm going to be putting red at the back because they need to be meeting like this. So I'm going to put blue down first. Can you hold that there, please? And I'm going to put the red around T1 at the back where we touched. Okay, so that combination, so they're pulling together. So as long as it's that combination, that's what we need. And hold. And no, that's not the combination. So now Denise just turn that over. So now we've got the red facing down and the blue facing up. And if you've got an orange magnet, you just make sure, as long as they go together, that's all you need to know, and you'll be able to see whether it's N with the side it's on. Okay, so now we've got the magnets there. You just hold that one in place, please. Hold that in place. Yeah. And hold for me. Lovely. And again, lovely. Right, okay. So that's definitely the combination for Deneen. Red down and blue up. So I'm going to leave them like that. So if we want to explore nutrition to help the person, now things that balance out blood pressure are going to be very similar whether it's high or low. So for instance, Megachel is fantastic for Raynaud's and all kinds of circulatory problems and low blood pressure. And it's also fantastic for high blood pressure. Capsicum is good for low and high. Pro-arginine is good for low and high. So again, we don't really need to be very concerned about, is it low, is it high, what do I test, what nutrition do I use, because it's going to be pretty much similar. Okay, so let's go back into that position of inappropriate blood pressure. Lovely, and hold me please, lovely, and I'm just going to lock that in. Okay, and hold for me, lovely, so we've got that locked in. So now I'm going to check Megachel. Now Megachel's being reformulated at the moment. We're Feb 19 at the moment, so if you're watching this video around this time, don't worry if it's out of stock, it is coming back. They're just changing the formulation slightly so it can get into the UK easily because it keeps getting stopped at customs. It's a real pain. So let's have a look to see if Megachel helps. And hold. No, it doesn't, not for me. Okay, so capsicum, parsley, garlic and parsley. That's nice. Okay, let's do it again. Yeah, that's very nice. One more. Okay, let's check for priority. And hold for me, please. Not priority. Okay, lovely. We've also got, you can use anything in the circulatory. Another really good one to test is the ginkgo and hawthorn, number 22. So let's test that one. And hold for me. No, nothing for you. High potency grey pine as well is a good one. Does something, but no, not enough. Garlic? No. Okay. Wow, okay, come down a little bit and hold. Right, that's very good. And priority? Okay, there we go. So the Pro-RG9 has come up for Deneen. So I would, although you're quite little, I would probably suggest 2 a day. Yeah. If you're still getting, cold. Yeah. Okay. Yeah, just temporarily, because on the boxes is 1 a day, which we usually follow, but therapeutically short term, we can go up to 2, and that might help further. Yeah. Okay. So that's good. So we've got our nutrition here, and what I'm going to do is I'm going to put the magnet red down and blue up. Yeah, I'm going to put it. Bras are very handy here. I'm putting it under the skin and at the back. Now, all we do is put the magnets there. That is the treatment. However, when my client's on the table, I never like to waste, even a few minutes without doing anything else. And although we are doing something, the body's going to be doing a wonderful job helping Deneen's blood pressure to become appropriate for her. However, what I am going to do is I'm going to do some gait reflex points. I often do those. And I can also do the cloacals, which are very grounding and relaxing while the client's got the magnets on. How are these gait points? A bit tender. Which foot's worse? Yeah, this one feels softer. Yeah, much softer. And this one, yeah, it's harder. I can feel harder, especially over the big toe. Yeah. Oh. Lovely. Okay, So then we can do some nice holding for her. How are you feeling?
I feel good. It's really weird.
Does it?
Yeah.
In what way?
I feel really light and
Okay. So she's feeling really light and fluffy while she's having this done. And the body's doing everything itself. We don't have to do anything. If the client would rather you not work on them while the magnets are there, then that's fine. But most clients do like some extra little techniques to be done while we're lying there. Now, the other fantastic thing we can do is not only is the homework relevant with the nutrition, we can also lend our clients magnets to use at home in the combination that we found in the treatment. And don't forget to recheck them each month because it might change. So they can go off and put the magnets on themselves as homework, which is fantastic. And of course, I haven't done emotion today because I wanted to keep it really simple for you. Although when you've got it locked in, you can certainly look at emotions with lack of joy and maybe a killjoy in their life, and work with those emotions and batch flowers for the blood pressure. Because emotions do come into it. Lovely. Going to do some 8s there. So we want to leave them a good few minutes. I've done gait, cloacals and 8s. And now I'm going to go back and check the blood pressure again. So over the heart and over T1 at the back and back to the quad and hold back, please. Lovely. And again, and hold. Lovely. And one more. Fantastic. That's very, very strong. Great. Thank you very much, Janine. So there you have the blood pressure technique, and you'll be able to do wonders helping people with their blood pressure. Thank you. Bye for now.